Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. My name is Muhammad Al-Sayyid. I'm one of the members of the Education Committee at the Syrian American Medical Society, SAMS. I would like to welcome everyone for this session. We actually did the interview skills workshop virtually this year, and we have concluded the interview skills workshop for this year. I would like to say that in the last couple of weeks, we had about 36 applicants. We also had 34 interviewers, and we were able to conduct 142 interviews. I think that's on average about 3 to 4 interviews for each applicant. The whole work would not be possible without the interviewers who volunteered their time. And also, I definitely have to thank Abdul Qadir, Wissam, and Majid for working on this project, as well as Jihad. Everyone was involved, and we were able to finish all these interviews with, I would say, with good success rate. So the whole point of this session today is to wrap up the interview skills workshop. Usually what we did in the past, after each day of the workshop, we have a gathering between the applicant and the interviewers. And we ask the interviewers to give us like 1 or 2 points that they would like to highlight, like maybe the common mistakes that they found, or maybe a common thing that they noticed when they did the interviews. We also want all the applicants to participate in this session, and we want everyone to ask questions. And this is the whole point of this session is actually for the applicants. So it's going to open a space for them to give us any questions they have, if they have any unsolved problems or any unanswered questions. So this is going to be your chance, because you're going to meet the whole panel today, and you're going to have a good number of interviewers who have good experience to answer your questions. So this is your chance to get any answers that you want from the panel. So regarding the panel, if I'm going to start asking the panel interviewers to give us a few points that they would like to share with us for about 15-20 minutes. And then after that, the applicant, they can give us any questions. In the meantime, you can definitely write questions. The best way is going to be through the chat box. So if you have any questions, just write them down on the chat box. If you don't want to send it in public, you can definitely send it to me as private, but I prefer to send it in public because it's going to be very hard for me to keep track of all the questions. So send me questions by the chat. If you want to talk, if you want to say anything, definitely raise your hand. You can find that option through the chat box. There is also an option to raise hand, and then we will get to you and we will ask you to unmute yourself. In the meantime, I would like to ask everyone to mute themselves if they are not talking. And yeah, I think that's about it. Let me start with...
Good morning, everyone. This is Wissam Kiwan. I'm here next to Badr Al-Hafid. I just want to bring everyone's attention to the fact that this session is being recorded. So that we can, have the useful information that's going to be useful for everyone be shared with those who haven't been able to attend this this question and answer session. All right, go ahead, Mohammed.
Yeah, that's great. So I have few names. Yeah. Let's start with Abdurrahman Katabi. Can you please introduce yourself, and if you have anything you would like to share with us?
Assalamu alaikum, everyone. This is Abdurrahman Katabi. Currently third year in internal medicine department in Marshall University in Huntington, West Virginia. First, I would like to thank everyone here that made this event possible. And probably Wissam Kiwan, probably he remembers me. I benefit from this project when he was doing the mock interviews. Personally benefited from this project. So I thought that I would like to participate and pay the Red Dain, if that's accurate. Currently, I'm applying for fellowship for PalmCrit, and I have done total 11 interviews on Zoom and on Thalamus. So I thought I might be able to benefit the people who are applying for the residency now. I can share my experience with you guys about the Zoom interviews and how to success in interviews. The match result is not out yet, so hopefully I'll be able to share some good points with you.
That's great. Do you feel like that there were any common mistakes or common things that you would like to give us any input about it?
Yeah, first, the technical issues actually, like after I finished probably 7 or 8 interviews, I realized that when I look at the camera itself, it does not make me that as if that I'm looking to the person from the other side. So I did not practice that before I start my interviews. I knew that from talking to one of the interviewees here on the mock interviews actually. So I thought if you practice how to look at the camera first, make sure that you can make a good eye contact through the screen. That's a very important point. Also, like make sure you have good camera, good light behind you. Avoid any noises and like just basic stuff, which all of the interviewees actually they've done that when they did the mock interviews. So basically, like, I don't have any specific advice at this time. I'm here just to answer questions. Honestly, I did not prepare anything in specific.
No, that's great. No, we would like to welcome anyone and everyone to help us in this session. Thank you, Abdurrahman, for your input, and I would like to ask Abdul Hakim Tleimat if you can introduce
can you guys
yourself.
hear me?
Yeah, we can hear you. If you can introduce yourself and give us any input.
So I'm a third year right now in telemedicine, Case Western in Cleveland, Ohio. Few points I wish the applicants kind of can understand. Understand that the interview is the rule out process. So when they look at your resume, they ruled you in with your scores, and then at the interview they are going to rule you out. And a lot of programs will use a lot of standardized questions. Standardized questions starting from tell me about yourself all the way up to a very difficult kind of behavioral questions to actually rule you out, to kind of kind of make you kind of fall into mistakes or see if you kind of fall into these mistakes answering those questions. So, I mean, if I can, I can't stress enough on how much you need to practice. Imagine yourself failing the tell me about yourself question. That's a very, very bad sign. That's kind of one of the points. Second point, the interview can go into 3 directions. You can actually kind of mess it up completely. You can get out of it safely, like you answered most of the questions, and you can kind of excel and leave a very good impression. And you have to kind of always try to always leave a good impression. You have to have talking points about your resume that you always have to use them, even you were not asked about them. You have to throw this in. You did this great research project or something, you have to throw this in somewhere. They should be a part of your tell me about yourself answer or somewhere, but those, strong points that you have in your resume, they have to be thrown in somewhere. Number three, I personally have seen a lot of those behavioral questions come up in my own fellowship interviews. I think those questions and every question in the interview has something that the interviewer is looking for. And I really want you to understand like what the questions that they asked and what are they looking for. The question about this behavioral question about, have you met a team member that, that was difficult or something like that, they're looking to assess your teamwork. Have you gotten like a very difficult or tough to swallow feedback from your attending? They're looking to see if you are, if you were open to feedback, you're open to feedback and you grow from the feedback and stuff like that. So look at those behavioral questions online. All of them have really, one or two words that they look for. And that's the goal of those questions. That's my third point, is the behavioral questions. My fourth point is everybody's talking this year that, oh yeah, you did not spend money on the on travels. So everyone is actually expecting you to have kind of very high quality audio and video. I've heard that a lot. You did not spend money on travel, so why can we hear you very well? So spend money on a good quality camera, on a good quality microphone. And I'm happy to answer more questions. And I don't want to take much time from other people. So anybody has any questions, I'm happy to answer them.
Thank you, Abdul Hakim. That's actually a great point. And I would like to add one more thing, is the internet speed. Because sometimes like you can have a great camera, you can have a great audio, but you don't have a good internet speed, and then you're going to have problems with connections. The next one, I would like to ask Mohammed Hamsho, if you can introduce yourself and if you can share with us any specific points.
Assalamu alaikum jami'an. Thank you, Muhammad, and other members for organizing this. Best wishes to the candidates. I'm surgery attending in my Montes Medical Center in Brooklyn. I did fellowship in liver and kidney transplant. I just want to add that, as the Abdurrahman mentioned, all the candidates, when they are invited for interviews, that's mean they are already pre-selected. And what the interviewer is looking for, just to know who's going to apply for his position, who's going to work with him, how does he look, how's his language, will he be able to communicate, to work with him for the next 3, 4, or 5 years? Is there any limitation? You touched base also on the technical issues. I was like doing mock in-service exam last week, and one of the resident has issues with his camera. His laptop was shaking a lot, this connection. So he left a very bad impression on me and the other attendings. So those are very important. And other than that, just like try to be simple, relaxed, and best luck, inshallah.
Yeah, thank you. That's actually a great point. I would like to ask Sana Abdewi if you can introduce yourself and give us any few points you would like to share with us.
Assalamu alaikum. أنا اسمي دكتورة سناء الديوي. Currently attending internal medicine at the University Hospital in Newark, New Jersey. I thought that those sessions were very good. It's a very, very good preparation for the applicant for the real interview. Having a very good connection and a backup maybe plan for if anything, any failure in your device is very important. Also, like probably many of us, because of the years of that you had to prepare or moving out of Syria and maybe preparing for the exams. So there is a gap in your work, work life that you have not done for a few years, or maybe 1 or 2 years after graduating, that's very important to know how to answer this question, because sometimes if you're not prepared to it and it just comes in the interview as a surprise, you will not be able to answer it to the best way. It's not something that you think that it's going to be like the end of the world for you. You're still going to be able to match or get selected for a pre-match, whatever is the case, but it still has to have a valid or explanation. It doesn't have to be always preparing for exam. There's many things that people have in their life that happen and they have to take a break, and that's okay. But just be prepared to answer the question. Otherwise, I think it was very, very good practice for everyone, for interviewers and interviewees. Thank you.
That's wonderful. We really thank you for joining us and give us your input. I would like to ask Jihad Al-Harash if you can give us any few points that you would like to share with us.
Assalamu alaikum. Can you hear me well?
Yep. Yeah. Everything's good.
Yeah. Hello, everyone. Thanks for everyone who worked on this. I think it's a very important workshop, and everyone benefited from it from the previous. And I would like to thank the volunteers who participated in this. Some of them, they actually benefited from this before, and right now they are working on to help others. And I want to encourage our new applicants, inshallah, they will all match in good programs. And I want to encourage them in the next year to be part of this workshop to help others. That's how it works, that's how the workshop is working for the last 10 years. And that's how SAMs in general work. My few points are, the first one is, like Abdul Hakim said, it's very important that you practice, especially for the common questions. And in my opinion, that is because you might get some difficult and unexpected questions. So you might screw in some questions. You might not give the best answer in some certain questions. And that's because you are not expecting those. But in the same time, for like 100%, you will get some questions that are expected, and it's not acceptable that you missed those questions. I mean, in 1 or 2 of my interviews, I asked the applicants, tell me about yourself, and it was not prepared answer at all. So I think it's very important that you prepare for the common questions because you might get an unexpected question. The other idea is, when you get an unexpected question, it's very likely that you might get something that unexpected. So sometimes the interviewer is kind of difficult. Sometimes they bring up some ideas that they just wanted to see how you react. So take maybe like a few seconds to think about it and try to answer simply. And even if you feel that you didn't answer the best, it's okay. It's not the end of the world, because they expect some certain questions not to be answered the perfect way. But practicing will help you on minimizing the chance of not answering some of those questions. My other important point, I think, is you need to bring something unique to the interview. So when you talk about yourself, or when you start the interview, just try to bring some idea that makes you remembered. So sometimes small jokes, sometimes something unique in your story that make you remember. For example, in my case, sometimes I joke about my name. My name is Jihad, as most of you know. And I just try to give some joke that, oh, don't be worried, it will be fine, something like this. Just throw it there, and most of the time it opens kind of small discussion. Oh, that's funny, and they try to ask about it. So in an interview I did before with one of the hospitals, they asked me. I mean, I did the same thing, and 2 days later, I saw one of my friends who worked in that hospital, and I told him, "Did they tell you anything about you?" He said, "Yeah, they told me that you were joking about your name." that's the only thing they remembered about my interview. So I felt that that is something nice, that they remember you, that you are somebody with a sense of humor, somebody is kind of like easygoing. Abdul Qadir will remember when we were starting this software, the Thalamus, when we were seeing how people use it. One of the criteria that people usually evaluate for is humor. So they say that how's the humor of this applicant? So you need to show that you are an easygoing, you are a nice person, because remember again that you are going to spend with those people in the hospital more time than what you spend with your family. So it is very important that they like you and they feel that you are a person that they will be happy to spend all that time with. That's my point. Thank you so much. Thanks, Mohammed.
Yeah, thank you, Jihad. Thanks a lot for these points. And I would like to ask Badr Al-Din Al-Hafidh, if you can share with us any points you would like to talk about.
Assalamu alaikum. So I'm currently attending Hospitalist in Ohio State University in Columbus, and I do work with residents, and we're involved in the medical school. I applied this year for cardiology fellowship, and I did a few of those, obviously all virtual. So everybody made excellent points on the virtual experience. I have nothing to add. What I would like to add is obviously prepare and practice. I found it best to write down. So make a document, put all these questions, write them down. Gives you a chance to kind of look them over, review them before each interview. Common pitfall that a lot of people fall in, including myself, after like the third or fourth interview, like you feel confident you don't have to review them, and then someone asks you the question that you're least prepared for. So kind of try to review that document with your prepared written answers every time. Another one thing I would say, and I told this when we did the mock interviews, whenever you're asked about strengths or weaknesses, or actually when you tell them about yourself, about your personality, anything you say that is subjective, like I have a lovely personality, you have to back it up with an evidence immediately right after. So I'm a hard worker. For example, when I was in medical school, I did a workshop that I built from ground up. I had to kind of coordinate and blah blah blah. They're not going to take your word for granted if you just tell them something, but you have to give them an example. I have a calm personality. For example, we have a lot of patients with opioid use disorder, and I frequently can reach out to these patients, and etc. These are the kind of points that I just like to add to whatever already been said. So, thank you.
Yeah, thank you, Badr. That was wonderful. Wissam, you are in the same screen, so if you would like to share with us anything that we missed.
Absolutely. Obviously, great points. Wissam Kiwan here, third year GI fellow, and I've done a few recent virtual interviews. So basically, I'm going to add to the, it's a good idea to bring up jokes and joke about the name or something like this, but just make sure that you're comfortable telling that joke, and make sure that it's kind of neutral and it's not gonna trigger any red flags, or it's not gonna backfire per se. So be sure before you say that joke. Number two, I would highly recommend that you are as comfortable as you could be. If you drink your coffee, then drink your coffee. If you usually drink your coffee before the interview. Make sure you sleep well before the interview and stuff like that. Try not to squeeze the interview in between a very busy schedule that you have, whether you are doing any kind of work. And then, another very good, excellent point that was made previously was about the fact that the interview could either go really wrong, or you can really kind of, end the interview with excellent impression, or just be neutral. I went through the interviews with a goal of just being okay. I want to survive the interview. If I'm going to be able to impress them, excellent. But don't push so hard to impress them or do something that is not necessarily nicely calculated, because it can go wrong, and that can really damage the impression that you can leave. And then regarding a question about fluency, again, accent is not an issue. You know, most of us has accents, and I'm sorry about the noise in the background here. But on fluency though, practice improves the fluency, but also you guys can notice that we keep saying instead of this, try to think. Let me just read one of the sentences that Badr was probably writing here on the chat, and I will give you comparison on how you can hide your lack of fluency. So he was saying that my advice on behavior questions was the following points. So instead of saying prepare it genuinely on your own first, I would say prepare it genuinely on your own first. See, I'm taking my time, but it's not breaking the fluency of my language. I don't know if I'm making the example clear, but try to hide that and you know, because I think that improves how fluent you look like, at least. And then another thing is, can't emphasize on this enough. Before COVID, every single program needed to make sure that you're going to rank them, that you are really interested in coming to their program, to their state, to their city. Now it's even extra more important because they know that everyone is applying all over the place if you have enough money to apply all over the place. So I had a discussion yesterday with my program director, you know, asking them about the experience since we are interviewing now for the new positions. And then he really emphasized on the fact that I'm not sending interviews for those who, you know, don't have any suggestion on their CV that they might be interested in coming to Michigan. But those who are already being interviewed are really going to be asked this question. And if not, you try to bring it up that, okay, I have family in Michigan, I have friends, be honest. I heard about the community, I like this or that. But you have to give them a reason that you are really coming to their program, or you're really interested in coming to their program. And I'm sure excellent questions coming from the interviewees are going to trigger more points, but that is pretty much it for now. Thanks, Mohammed.
Thank you, Sam. That's wonderful. I would like to ask Abdelkader Sha'ar if you have any few points before we start receiving questions from the applicants.
Yeah, thanks, Mohammed. Good morning, everyone. Abdelkader Sha'ar, I'm a hospitalist at New Haven Hospital in Connecticut. I'm just going to give a little bit of different perspective. I was on the coordinator side on this workshop, and I noticed few common mistakes that I just wanted to emphasize to everybody. Maybe some of you heard me talking about those in the past. Number one, make sure when you are sending any emails, the first thing that anybody is going to see from your email is your name. And many of us made our emails a while ago, and we had like you written whatever name you put your initials or first name and then the first letter of your last name. Just make sure your name appears as it should be. I've seen a lot of these this year, so just make sure you double check your name on the sender's field. And then obviously this is a common sense, but double check every single word you're writing in your email. There are a lot of common things that can happen, and it's easily preventable. And again, your email is your kind of first impression. First impressions matters, but they matters mostly, I mean, if they're negative, then you're just ruled out. As Abdul Hakim mentioned, I mean, these things matters. Now, a few other things. When you get an interview, be prepared to just respond as quickly as possible. Many of you are involved in work, research, rotations, whatever it is, but be prepared to set up your notifications on your phone. Make sure that your email notification is showing on your lock screen. You will get notified immediately, and be prepared to have access to a computer or through your phone or whatever it is to really respond as quickly as possible. With the virtual interview now, a lot of programs are using automated systems because now they have more money to spend. They're not inviting applicants in. So they can sign up to Thalamus like we did. They can use Interview Broker or whatever it is. So a lot of these things are automated. So you log in and you have a few spots and you have to just sign in. Now, most of the times they will send interviews per spots they have, but sometimes they may send interviews to extra few people and they end up on the waiting list. You don't want to have this done. And if this happens, then it is what it is. You just will have to deal with it and wait for your turn. But then if a spot opens, you have to respond very quickly because they can go away quickly. A couple other things. Yeah, one very important thing, we had a few of these incidents. When you log into an interview and no one shows up, this is not normal. So be prepared to call, like have your emergency contact person on that program, which is usually the coordinator. So call, email, whatever, like you wait for 5 minutes and no one shows up. So it's either an issue from your side, you're in a different room, or the interview. If the interviewer had an issue, they will reach out to you, but you just want to make sure you are not making any like mistake. So this is very, very, very important. So be prepared and know their contact information. Practice the technical part. Practice this is new to everybody. Most of the people who have been working or involved in some sort of hospital work, they have been using Zoom. If you have not, you can sign up for like whatever free account and just log in yourself, create a meeting and practice with your friends or your family members. WebEx is another common platform. You can sign up for this as well. I see some of you have a professional picture as a profile picture on Zoom. I think this is a good practice, so maybe you can have one as well. So make sure you put it in. Sometimes you're in a group meeting or you don't have your camera on for a reason or another, so that may play a role as well. And I think these are my main points. Yeah, thank you and good luck everyone. Hope you guys have a very successful match, and a super big thank you to all our interviewers. Without you guys, this wouldn't happen. Thank you.
Thank you, Abdelkader. Really amazing and important points, especially from the technical part. So I have a couple of points I would like to mention. The first thing is we mentioned that many times, but we need to keep reminding everyone about the technical problems, because this is the most important thing, because this is the only way they can receive the information from you, is through a good quality camera. The speed of the internet should be really fast, and also the audio. Otherwise, they will not be able to get to know you. The second thing is the eye contact. Make sure that you always have an eye contact with the person. I've noticed that some people, they just look on the side, they look up, they look down. That means that you are hesitant, you are not confident. So keep your eye on the screen. It doesn't matter if you look at the screen or you look at the camera, it's fine as long as you keep looking straight and when you're talking. Also, there's one more thing I would like to mention. It was not that common, but it happened a few times that I noticed in the personal statement. Some people, they mention that, during when I was in Syria or when I was in that country, the doctors treated my father badly, or they did not, they were not able to diagnose my family member, and they were not able to treat them. They did not provide them with a good care. So talking bad about other people is actually not a good thing. Same thing during the interview. When we ask you, like someone asks you about your medical school, or ask you about the healthcare system in Syria, and then you start bursting and saying, oh, I have this bad experience and I have this bad experience. I don't think that you should share bad experiences. I think you should stay always positive. Say the positive things and focus on yourself. Don't focus on other things. This is your opportunity. This is your time. You have only 10 to 15 minutes to shine. And those 10, 15 minutes, if you're going to spend 1 or 2 minutes talking bad about something else, I think you're not doing yourself a favor. Actually, you're doing something that's going to hurt you. So avoid talking bad about anybody. Just stay positive. Say the good things. They may ask you about, like, did you have a difficult person that you worked with? Yes, you had a difficult person that you worked with, but then you fixed that problem, or you were able to manage it, or you were able to handle it, and it went okay. But don't talk bad about that person and saying, oh, this person, he was like arrogant, he was not helping us, he was not doing this. Yeah, try to avoid that. And the last one is whenever you ask. Whenever you answer a question, try always to link it to the residency application. Like I ask you about clinical rotations. You answer me, I did this rotation, I did this rotation. But then if you stop there, then what's the point? You need to continue. You need to start saying, okay, I did all these rotations. That actually gave me an excellent clinical experience that prepared me to apply for residency, and I would like to continue learning during my residency. So try to link everything to the residency application. I think these are all my points. And I'm gonna stop talking. It's been like 40 minutes. So I'm gonna start with the questions that we received from,
Sorry, Ahmed, just before we start with the questions, I just want to make a 1-minute comment about the survey that was sent to the applicants, to the interviewers. So in terms of how the pool overall performed, it's a small sample, 34 responses, but I'm going to say that 75% had a score of 4 or 5 from 1 to 5 in fluency. That's not bad. And then on professionalism, 95% had 4 or 5. That's also good. In terms of preparedness, the average kind of came closer to 3, but it's still at 4. So, 20% were 3, and then 45% were 4, and then 30% were 5. And in terms of the appropriateness of the answers, it was similar to the preparedness, which makes sense. And it was about, the average was between 3 and 4. That's pretty much it. I think we're ready to take some questions now, Mohammed.
Yeah, that's good. Okay, so I'm going to start with the questions one by one through the chat box. So I'm going to start with this question. Is there any resource to get an idea about behavioral questions? Anyone from the panel would like to tackle this?
Yes, actually, I had this issue, especially with Michigan programs now during the fellowship application, and I believe it's very similar to the residency interviews. Actually, the program director of the hospital that I applied for, she published a paper on ATS about the behavioral questions and what they are exactly looking for. So what are the values? What are the points that they will evaluating you on? So I shared this link actually in the comment box. I hope everyone can see it. There is a link about the study. I believe you might need to buy the study, but if you are in a hospital or research institute, you can get this paper for free.
I actually made my own list preparing for my own fellowship interviews. I was planning to kind of put the question and put the answer on the Facebook page. I was like really super busy, but I'll just have a list of questions and, the best answer that I came up with on the Facebook page. But I mean, it's in the works, hopefully in the next week. But yeah, just like Abdurrahman said, it's there's always a deliverable for those. Teamwork, ethical question. What if you're attending this in the room and you don't agree or something like that? It's an ethical question. Patient advocacy here is the question. You always have to be like a patient advocate. But I mean, I made my own list, so I'll share it soon.
So the point in general about behavioral questions, they just want to know how do you deal with difficult situations, like if you don't agree with your colleague, or if you have a difficult senior to deal with.
or if you went through a difficult situation, how did you manage it? The main point is they want to see what's your reaction to these situations, and also try to close your answer all the time with a good point or positive point. Don't just mention the bad situation that happened with you, but what you have done to fix the situation. What's your reaction to the situation, and what's the outcome of the situation? For example, one of the questions they asked me about, tell me about feedback you received from your attending and you didn't like it, or tell me about feedback you received from a colleague and you didn't like it. Also, tell me about a difficult situation you went through and how did you manage it. So those kind of questions that you can always put I would say tailor the answer according to your experience. You don't have to mention anything happened inside a hospital or during medical experience. Most of us didn't have a medical experience when we applied for residency, but you also can mention like some situations that you went through during your daily life.
Yeah, that's great.
I mean, one last word. You can't say like, oh, this didn't happen to me.
Yes, yeah.
Yeah, you can't say that. You have to come up with something. Unfortunately, you have to make something up.
Yeah. You have to say something, because otherwise they will think either you are not prepared or you never had an experience, and you don't have any clinical experience. Because if someone has clinical experience, you're going to see that a lot. You're going to see, like, within a month of being on the floor, you're going to have like difficult people, you're going to have difficult patients, you're going to have disagreements. So this happens all the time. So if you say, oh, that never happened to me, that's actually not a good sign. That means that you did not have any clinical experience. Yeah, no, that's a great point, Abdul Hakim. So the next question is, any tips on approaching what is your weakness question? Like most answers online are cliche, and then you're too genuine, that can backfire sometimes. Anyone would like to tackle this? How to approach what is your weakness?
Mohammed, just since the connection was interrupted briefly, the question is about weakness.
So I mean, I'll say quick things. Very difficult question, honestly. Very, very difficult question. Not an easy one. You have to prepare for it. You have to pick something. Unfortunately, that's like just like the person who asked the question, not very kind of damaging and not very superficial. And you have to show that you are working on this thing. Reflect on that weakness and show that you're working on it. It's very personalized. You have to kind of look at your resume, look at your past, and kind of choose something. But reflection on that thing is what they are looking for. Reflection and the plan that you're fixing it.
Yeah, exactly. The plan is super important. So the way I got away with this question during my interviews for fellowship, though, I should say, is that I highlighted the fact that my in-training exam results were not very impressive, and I really wanted to have better results to reflect better knowledge. And I'm saying that why I have already know what my scores are and where they are located on the scale of good, bad, and excellent, and stuff like that. So, and then I said, and then I came up with a structured study plan during my light rotations. This is just an example. And the results are yet to happen. I haven't had an ITE again, or the results are such and such. If I may add, since we got the mic. So yeah, like Wissam is saying, I guess I just want to stress, well, any weakness you mention, you have to see with a plan after, like what are you doing to improve that? So you identify the weakness, that's good, but what are you doing to do it, to kind of overcome it? There's always one escape. Like if you can't end up finding anything, is like I can always use more experience in. Mention something you have, but like it's low. Like for example, I use more experience in writing manuscripts. I have one out, but I still can always become better researcher. I use that too. There's always a but like a few things to never say in weakness is your clinical experience that you're expected to have in medical school, your language, because you have to speak to everybody, especially IMGs. So they're talking to you, right? If they don't like your language, that's fine, but never say you don't, that's a weakness. I don't know, I guess the panel, like these no-nos are good. Like, I don't know if the panel has anything to add, but just one tip, have 3 weaknesses prepared, because one time I was asked, tell me 3 weaknesses. So if you have only like 1 or 2, I know, might not be enough. Yeah. To add to the no's, it's a kind of a soft recommendation against, per se, is I am an OCD kind of person. It used to be a good one, but everyone has used it. And I'm sure every single interviewer has heard it. I probably used it 5 or 6 years ago, that I'm, so OCD about being perfectionist and doing the job in a certain manner. Well, this is not necessarily a negative thing. A doctor should be thorough. So just be mindful of that in case this is what you have in mind.
Or I'm too passionate.
Yes,
and
there's no too passionate.
There's not, yeah.
There is also one, please guys avoid it. Like I'm slow typer and I'm trying to improve my typing skills. It's very old one. One time I tried to use it and the outcome was very bad, honestly. So there is one I personally use sometimes, but it depends on the situation and depends on the person that you're talking to. For example, myself, I'm an introvert person in general. So I would say sometimes I have an issue, like sometimes I feel shy talking to a group of people. So especially when I talk to family members, patients' family members. So I improve that by, I put myself in these situations all the time. I go to the family doctors, family physician meetings, especially in the ICU, for example, and improve my communication skills in terms of how to break bad news to the families and how to improve my skills talking to the families in difficult situations, for example.
Yeah. I mean, I think there are a lot of weaknesses you can mention, like a lot of examples. Some of the examples sometimes I use is that I had. So when you start to mention any weakness, first of all, use the past tense. Don't say I have this problem. Say I had this problem. When you say I have this problem, that means that you still have it. So start with saying I had maybe a problem or I had a difficulty with receiving feedback from my colleagues or from my attendings. So what I did, I took a course of receiving how to receive a feedback, and I started to understand the situation. I started to understand their point of view, and that actually helped me to improve my communication skills, as well as it allowed me to learn more about مثلا a specific topic. فدائما حولها مثلا انه it was something but then you improved it, you overcame it, but also how did that change you. فمثلا that was an example of weakness. Okay, so let's move on because we would like to go through all these questions. So the other question is it safe to say the lack of thorough inpatient experience is my weakness since I did not have previous training? That's not a good thing. I think we just mentioned that you should always say I have like I have a clinical experience, I have this. If you don't, then try to avoid talking about it. Try to avoid talking about the negative things in your CV. Like some people, they may start to say, oh, I have like very low USMLE scores. I failed this multiple times. Don't talk about the negative points. Talk about your strengths, because that's what they will remember during the interview. They may not notice these things in your CV. They may notice only like your rotations, your research, but then don't bring it up if they don't ask you about it. So that's my input about that. And then could you please give us examples of unexpected questions? Yeah, I'm going to start with this, and then I'm going to open it for discussion to the panel. One of the unexpected questions I had actually a couple of years ago when I was interviewing for GI, one of them was, give me one thing that you are most proud of, like one achievement on the personal side and one achievement on the professional side that you are proud of. That was unexpected. What is يعني the main point from that question is that what is the most important thing for you in your career and the most important thing for you in personal life? That's actually a very good question to know you as a person. Yeah, and if any unexpected questions that you guys had, I would like to open it for the panel. Share with us like these weird, strange questions so we can have them on recording.
Now that unexpected has been brought up, it's probably time to mention how to deal with illegal questions. And I did have a few of those, such as how many other interviews have you had? Or some questions related to your own family that should not be asked. So it's a little bit tricky. It depends on the situation, who you are interviewing with, how high you're considering them to be on your rank order list and stuff like that. One question was about the interviews, for example, that I've had. You can try to be diplomatic and politically correct and say, yes, I've had a few interviews here and there or there, but that person insisted and went on and asked, okay, how many? You know, it was obvious to me, since that program wasn't, you know, necessarily a competitive program, that they're trying to see whether I'm going to be ranking them or not. So again, it really try to put yourself in their shoes and try to kind of guess what they are trying to get from this question or that. There, you know, fewer and fewer illegal questions are being asked because there's really a lot of emphasis on not asking these questions. When we interview for medicine or for GI, they ask us, you know, hey, see these questions, don't ask them. So I think you should probably not happen. But regarding other unexpected questions, I will leave that for others.
Actually, one of the interviewers one time asked me a question. In everyone's life, there is an occasion that you were faced to decide doing the right thing versus the easy thing. So give me an example of that. So actually, that was an unexpected question. It's actually mentioned in that paper that I cited here. Also, I was asked a question, as Wissam said, how many interviews that you got. So I find a way to escape this question. I said I got a good amount, and I'm interviewing in programs that I wanted to be interviewed at. So
that's nice.
You give them the impression that I actually interested in interviewing in your program, but it's not the only program that I'm interviewing at.
In my opinion, most of the unexpected questions come for questions that they want to check your professionalism. They want to see how professional you are dealing with certain occasions. And many of them, they ask questions about, for example, cases that really happened in their programs before, and they want to see how would you handle it. So for example, I was asked once if there is a kind of conflict between you and the nurse. That's not very unexpected, actually. Many people even talk about it right now. But if you have some conflict with your senior, if something happened between you and one of the patients or one of the family. So in general, the way to think about those are to think about professionalism in general, and just to put the patient first, to put the privacy of the patient first, and to be the professionalism, to put the professionalism between you and your colleagues first. Those are the ideas that you have to keep in mind in general.
That's
Just
great.
to add what the guy said, so that you can prepare. First of all, again, prepare, know your resume, know your strengths, your weaknesses, and that's the thing about unexpected questions, right? They're unexpected, so you can't prepare for them, and that's the point of them, to see what you do in unexpected situations. So just like Jihad said, and like Dr. Abdurrahman, to kind of be professional, be calm. And I think one unexpected question I had was, if you had a superpower to write your resume in 50 years, what do you want it to have? So I started to answer him, I was thinking, okay, let me answer you the question, where do you see yourself in 10 years? Because I had that one prepared. He was like, no, I'm not asking you that. What do you want to be written? And I kept trying, but like eventually he was like, okay, I asked this of everybody, like you're on the right track. But anyways, so that's the thing, just, do your best. Hope,
At least here, this goes back to the idea about you didn't mess up the question though, right? Maybe you didn't ace it, but you did not mess it up. So
right.
That should be at least your goal.
And what helped me was preparing, maybe another question, but
Right.
kind of think quick on your feet.
Just think what a reasonable guy would do. Just common sense, being nice to everyone, putting your patient care top of everything, the priority to professionalism and stuff like that, just common sense.
A couple questions, actually, I was asked about them before. What's your favorite color? So honestly, that was especially probably, as far as I remember, Wayne State program, they asked me that. So I was like, because I talked about like my experience, like volunteering in Syria, blah, blah. So it was a good situation to say my favorite color is white. So they asked me why. I was like, because it's the color of peace. And I found that answer was cheesy at the beginning. So I was like, you know what? No, actually my favorite color is green. And they asked me why. I was like, because it's the color of money, so that make a joke at that time. I tried to escape from that situation. Also, if you want to change to an animal, what animal you choose? Something like that. You can choose like cliche answers like a bee or an ant, because they work in groups and they are, I want to be a team worker like them, something like that. It's very cliche answers, but that's one time actually one of the colleagues told me that they asked him, if you want to change to a dinosaur, what kind of dinosaur you want to change to? I honestly, personally, I don't know how to answer that, but that's one of the questions that people that got. Take home message, don't stress about these questions. Actually, these are the exceptions. So as long as you prepare for the general main questions, you'll find your way to find the answer for these questions if they ask you an unexpected question.
Yeah, you can answer the question about the dinosaur that I want to be a crocodile, a dinosaur that survived.
Okay, so let's move on to another question.
Sorry to interrupt you. This is Majd. Hey guys, I did not have a chance to introduce myself. I'm Majd Jazarli. I'm chief resident right now in USF Lake Medical Center, Tampa, Florida. So talking about like weird or hard questions that I had. So basically, like I'm applying right now for cardiology fellowship, and I got this question. It was like a little bit hard for me, and it took me a second like to start answering it. So it was also a panel interview. So like everybody was like looking at me waiting for the answer. So they asked me like, if you had a chance to sit down with two deceased people, who would they be and what would you talk to them about? I was like, oh my God. So I took a second, as like everybody mentioned before, just if they're asking you unexpected question. So they're looking into your reaction. They want to see, are you going to keep the eye contact to the camera? Are you going to move around on chair? So are you going to move your head? What are you going to do? So I try to keep calm as much as I can. And the first one came to my mind was my dad. He passed away. So I told him, I will tell my dad he passed away 9 years ago. I'll sit down with him, tell him the progress that I made, where I am right now. And like I told him, like I'll tell him about the family too. So the other person was so hard to pick. because I'm not gonna tell them my mom, she's in Syria, I miss her. No, it's not valid anymore. I had to choose someone else, and they asked me about like deceased people, not even like people like alive. I was like out of blue, it came to my mind like Kobe Bryant. I was like, Kobe Bryant. They were like, what? Kobe Bryant? Why? So the program director, he started to laugh, like, why Kobe Bryant? I was like, he's one of the best basketball ever. So I just want to sit down with him, ask him about like his hard work, his consistency. How did he make it to that point? Since that he is one of the greatest ever, he is not like average basketball player. So I just want to see what secrets he had, what made him one of the best ever. So I mean, after the interview, my friend, he is a fellow there. He texted me about this question specifically. That the program director, he loved my answer, especially about like Kobe Bryant. I was like, oh my god, yeah. So basically, just try to be calm, try to be yourself, take your time, and then like analyze the question. And if you don't have any answer, just like try to do what better sorry, Wissam, I think, or Abdurrahman, like try to run away try to run away from the question, but in a smart way. All right. I had a couple of questions also. I forgot about them. I was not able to answer the question. So I tried to like switch it a little bit in a way that I can answer it, and I have a strong point about it. So I tried like to switch it to that point, and it works for me. Sometimes it works, sometimes it will not work. So,
But Majid, you would agree with me that you still want to pay attention to what the question is exactly. You may be able to tweak it around a little bit or something, but you in a way or another, you should try to address the question mainly, right?
oh, of course, like the program director or the faculty, they're not stupid. If you're not answering their questions, they're gonna know that, oh my God, this guy, he skipped the question. But the way that you're gonna tweak it, very important. And and of course, try as much as you can to answer the question, but be calm. Like just take your time. It's okay if you take a second or two to think about the question, but try to answer the question, because they're not stupid people, the people that they're interviewing you, and they're gonna know that, oh, he did not answer the question, but he took it in a way that it was a good way. So yep, that's my point.
Okay, so thank you, Majid. That's actually a very good point. So I think we covered that question. Let's move to the next question, which is about tell me about yourself, which is usually the first one during the interview. How long should we go on for, and should we focus on personal life and or professional career or academic strengths? So just like the main point, I would like to ask Mohammed Hamsho or Sana Abdewi to give us their input.
Well, to me, I mean, it was a general question. Like I was born and raised in Syria. I did my medical school there, residency. Then I was fascinated about the American way of training surgeons after working with a few American surgeons, and I decided to pursue this kind of training, regardless how much it would cost me or take me to do. And I went through the exams. I passed them. I got ECMG, and I'm so lucky today to sit with you applying for a position in your program. So I tried to make it brief. I didn't go into details a lot, and I gave them the opportunity if they want to ask me more about my previous training. That was an entrance actually, and many interviews to ask me, now you are at the level of attending and you're coming to work as a resident or as a fellow, how you're going to take that? If somebody with this knowledge asks you to do something, how you're going to deal with it? So I just found it an easy way, quick way to introduce myself and give them the opportunity to ask me questions.
Very good points. Any input from you, Sana?
Sana, sorry for interruption. Just a moment about the unexpected question. I mean, being from Syria, more than one time they would ask me about the political situation, the revolution, how's it going. I was surprised even one of the interviews that happened after one of the masters, and he asked me what happened in Iraq. So be prepared. Some of these reviewers are very well, like on top of what's going on. They're interested for some reason.
Mohammed, would you be able to raise your voice a little bit? The last part wasn't very clear.
It's better now?
Yes.
Yeah. Yeah, I mean, you don't expect them to ask you political questions, but that's happened in more than one time, especially in New York and the around areas. And they look like they know a lot, and they just wanted to explore what's my views. I tried to make it as political as possible, so I told them that I'm against dictatorship, but I wish it was done in more peaceful way, because you don't know who's the other side, what is he thinking, and on which side he is. So I didn't want to give like firm answer, and that way I try to navigate my way through this question.
Any input from you, Sana?
Tell me about your self question.
Yeah.
I think this is one of the most questions that you can practice at home, and try to be very brief. At the same time, describe yourself in a way that you would like people to see you. What the thing that you don't think that is shown in your CV, or maybe in your personal statement, you missed it, and you want to highlight it. It's something important, but sometimes you always miss things, and you've lost the chance to put it in your CV or your personal statement. Maybe you want to highlight it, but you always have to practice for this question, because you don't want to be sitting and trying to remember things about yourself, and try to say it. You're not able to bring things to the interview, or to tell them about yourself. If this is something that you're unable to do in a very brief comments, it's going to be very hard for the program director or the interviewer to see how confident in yourself you are, because this is something that you have to be confident about. Don't brag or over highlight things that you may not be important to them. Don't try to fill anything that is a little bit unrealistic. It's just you have to be yourself, whether you want to bring the humanistic part in your personality, your sense of humor, your love for sports, whatever it make you feel that might connect you with people and work before. It might work in an interview, but it may not always work for the person that you're interviewing with. So you may practice the same question for different people. So the program director might be looking for something. The faculty person who's interview might be looking for something else. So it doesn't have to always be the same answer for everybody, because you may be the person who's asking you the question is going to be judging you in a different way. So always be prepared to be flexible, but like I said, don't put any fillers that is not actually realistic to your situation or not true.
Yeah, that's very good advice. I would like to move to the next question. So because we have a lot of questions and we need to finish that on time if possible.
Can I say one quick note?
Yeah, sure.
Everybody has a camera and a microphone now. Sit on the desk and videotape yourself doing the tell me about yourself question, and give yourself 60 seconds. And every time you do it, you'll become better at it. You say, "Oh, I can do better. I can do better," until you actually you define a result and you like yourself saying, "Tell me about yourself." So just use, the simple in Windows, the simple video recorder, and just review your own answers.
Excellent points. So the next question is it a good idea to send emails to the programs that you are interested in them? Majid, do you want to answer that?
I'm sorry, what is the question? I'm sorry.
Is it a good idea to send emails to the programs that you're interested in them?
I mean, of course, if you want to stay in Michigan, of course you're gonna apply almost everywhere. It's not easy these days, the residency. So you're gonna apply everywhere. But if you would like to stay in Michigan, it's not gonna hurt you to send interesting email that, hey, I'm in Michigan, I have family, blah, blah, blah. You explain everything like in just like 2 or 3 lines max though. Don't write like a long email, letter of interest. It should be just short and to the point. And yeah, of course, it's not gonna hurt your CV, of course. Probably it's not gonna benefit you at all, but definitely it's not gonna hurt you. And if you want to send like letter of interest to all the programs that you applied for, you can do that. It's not gonna hurt you, but it's not gonna bother you. I send like to one of the programs that applied for cardiology fellowship. I sent letter of interest. After like almost 3 hours, I got rejection from them though. So it does not mean that they sent me the rejection because of the letter of interest. They sent me the rejection because actually they looked at my application, they did not like it, and they sent me the rejection. But if it did not happen to me to get an invitation through letter of interest. But some of my friends, they got invitation after the letter of interest. So it could work.
Right.
Or it could not, but it's not going to hurt you at all.
Yeah, Majid, I'm going to really emphasize on this. This is a very excellent question. I did send emails. We're talking about interest in programs before you get interviews. This is what we're talking about, just to make sure that it's very clear. So I sent many emails. I think 2 or 3 of the interviews that I got during residency, and probably 2 or 3 of advanced endoscopy interviews I got were because one way or another because of the email. Yes, you might get rejection, but as Majid has just said, it's just, you know, عم تنكشها بس للrejection مشان تجيك. It's nothing beyond that, I don't think. But make sure, be careful though. I did send a letter of interest. I'm not very proud of that, but I'm gonna share the mistake with you so that you guys don't repeat the mistake. I put the wrong state. I'm very interested in coming to Florida, and the program was somewhere else. And that was it for me, of course, right? So I'm not going to be, even if I was to get an interview from that place, I broke my bridges, as they say. So I recommend that, and do that early. If you want to do that, don't wait until you find out that, oh, everyone is getting interviews. I should have done this. Start working on that. Send short, correct, individualized emails. Short, correct, accurate, and individualized emails as email of interest to the programs, as many as you could.
Two very quick points. Remember in the beginning, we said it's a rule out process. If you make a mistake on your own email, so you actively made the mistake and you actually kind of shot your own leg. So don't, be careful. And number 2 is really honesty. You know, emails before and after, you have to be honest. All the program directors, they know each other. They have an email listserv. They all email each other. Fellowship program directors all know each other. You know, you're sending someone, I rank you number 1 or something. I mean, I know we're talking about before and after, but in general, be careful. You have to be honest. You have to be sincere. No false information. No, be careful from that standpoint.
Also, phone calls. Also, I noticed actually phone calls sometimes they might get you an interview, especially if you have a connection in that program. Sometimes even the connections, like, because everyone has connections, especially in the big programs. So programs, they receive a lot of recommendations from the faculty and friends of the program directors. So whenever you call, you show an extra interest in the program. And I got an interview like 3 hours after I called one of the programs.
Badr? So the email, it's a little tough because, like Wissam said, you have to have them individualized and short and be truthful and send them early. So they take time, so start on them early. For me, I sent letters about half of the programs I applied to. Most kind of just ignore you. Some are like, oh, thank you for your interest. We're reviewing applications. And some actually coordinators told me that, okay, thank you for your interest. I added this letter to your file. And actually 2 programs I got interviewed there. I don't know if it's from the letter or not, but it's something you can add. So if you're really interested in those programs, send at least a dozen to those, you know, your top ones. Regarding the phone calls, it's funny, because I also applied for cardiology, and I tried to call many, and I only was successful in like 2 or 3. So be prepared to what you're going to say on the phone, because one time I got a really rude coordinator and like got me off balance, and I'm not proud of that phone call. So when you call them, don't start like, hey, I live in Columbus, I really want to stay here. I'm like, no, start with, the coordinator literally told me like, oh, we like to be groomed, we like to be kind of, tell us why you want to come to us. So I'm like, sure, I sent you an email with that, but I can say that again. So, you know, also try to be brief on the phone. They don't have all the time in the world. Most programs, though, that I tried to call, and I tried to call like a dozen, and I only got three to them. A lot of them are like, you go to the voicemail. Some have a voicemail saying like, during COVID, we're working from home, we're not checking voicemail, just email us, which I already did. One program actually sent a mass email to all their applicants through ERS, and they said, please stop calling us because we don't have time for this. And it was actually a small program in like in nowhere, Ohio. So that was funny.
Yeah.
There is a trick that you can use in the emails. You can time the time that you want your email to send the email to people. Like, for example, usually people, when they go early in the morning to work, they check their email first thing in the morning. So if you send the email, for example, at 3 p.m., they might probably stop checking their email that day, and their email, actually, they get filled with other emails from other people, and your email get very low in the lists. So if you send it, for example, if you time it to be sent 3 to 4 a.m. in the morning, it's the best, excellent time to send the email at, because they will check their emails first thing in the morning, and your email will be at the very top of the unread emails.
Just don't send it on Mondays. I completely agree with that. Just don't send it on Mondays, because there's like an email fatigue every Monday. Like, ask anybody who's in a university, they'll tell you Mondays emails are terrible. So send it Tuesdays the best.
I wanted to say my favorite is Tuesday. That was
Let's move on. I'm sorry. Let's just move on, because we have a lot of questions. And we don't have that much time. So I would like to ask this one. So this one, it says, I did a mock interview with a doctor, and she asked me that you reside in Michigan and your husband is a pathologist in Michigan, and you have applied to our program in that state. And you know that it's not easy for a pathologist to find a job in the area. How we know you will rank us, and what do you think that the answer should be? Anyone would like to take that?
If no one else, since I have some information, Badr, you have something in mind?
I was just going to suggest be truthful. Like, if you're really willing to move that there, just tell them I am, and my husband is helping and understanding.
Yeah, I want to say my husband is going to be very supportive of me. And as a matter of fact, I actually applied to the places that already has several job opportunities. And your program is one of them, something like this, that I already know this, I'm prepared for this.
Yeah, that's good. Next one, do you recommend to do the interview in the school as they have a higher internet speed rather than home if this option is available? I don't know if Abdul Qadir want to take that if he's available.
Guys,
I think Badr had a point on this point, when we did the workshop. So I defer to Badr. I don't have experience with, like, I think he mentioned the libraries at schools. In my opinion, it's okay, assuming you really have a quiet place to sit at and nobody's gonna come into the room while you're doing this.
Yeah, if you have a closed room and a controlled environment and reserved time, and you're sure nobody's going to knock on the door or just bother you, that should be fine. But don't do it in the hallway or like in the common areas. Never.
Guys, I had an interview a few days ago, and literally the coordinator, she sent me like, I'll read it to you, like the 3 points. She sent me those points. She, like, first one, try to be in a private location, empty room for the interview. Take off your mask if possible. Test your wife's Wi-Fi signal strength of your location ahead of time to make sure you have a high quality internet connection. Consider using an external microphone and or headbuds. Have a backup way to join the meeting, like a cell phone, in case there is some connection issues through, like, they used Microsoft Teams. And turn on your computer 5 minutes before the interview is scheduled. this is not. Make sure to have your computer. Make sure to have computer/phone charger with you. So basically, those, like one of the coordinators, she sent me those instruction and those like notes for the interview. So I mean, this is also the guys before, they mentioned all these points before. So I'm just like, I just read to you exactly how the programs are thinking about the interviews. So try to stick with those notes as much as you can.
Yeah,
Also, guys, if you can please avoid using the weird backgrounds on Zoom, because I've seen people using them and they make them honestly look very weird on the camera. Like, just make your background normal, like anything, but make it normal and organized.
I'm sorry here, but Ahmed, I think he raised his hand.
Yeah, I think, yeah, I was thinking about answering the next question, and then I will let Ahmed if he want to talk.
Yeah, guys. So I have a question, please. Is it better to contact the program director or the coordinator for the letter of interest? Thank you.
Yeah, so I think regarding the letter of interest, you know, I understand that a lot of people here, they're talking about their experience when they are applying for fellowship, which is not exactly the case for a residency. When you are applying for residency, it's actually really hard to make individualized emails for each program. It's very hard because you're applying to like 150, sometimes like 200 programs. So it's really hard actually if you want to send 50 or 100 emails, make each one of them is individualized. I would say if you can send the email to the program director, then go ahead and send it. If you don't find the email, or if you think that that email is not working email, try to send it to the coordinator, but also start by saying, dear blah blah blah, I would like to ask you to forward, or maybe try with the letter of interest, and then at the end ask the coordinator, please, if you can forward my email to the program director, so he or she can consider me for an interview. So I think that will be also possible. You can do that. Next question, it says, what about if we have clinical experience? Should we talk about it? Definitely. I mean, you need to talk about clinical experience, if you have research experience, any strengths that you have. The next question, any tips on biggest failure questions? Like, we all have examples of mistakes, instances we failed that were not dramatic enough to be biggest. Anything we should absolutely avoid saying? Anyone would like to tackle this?
So, you know, I can definitely say, I bet you that everybody in this meeting had a failure at some point. You know, this kind of profession that we're in has a lot of those. So please prepare for the questions, select something that you've been through, reflect on it. What did you learn from it? How did you move on from it? Show them that you did learn from it, moving on. And if it happened again, you know, you took the steps that that would make you not fail this time. But again, practice. I was asked this question multiple times this year. You just needs a lot of practice and reflection on that failure.
Yeah, that's great. Can we talk about setting priorities as weakness in the past, and I worked on it now? Setting priorities? I'm not sure.
I think, Mohammed, it is meant to be, what is my priority in life? What should I focus on in terms of using my time? I think it's a good idea, but all depends on how you're going to be explaining it and giving examples, and then giving a plan of fixing the problem per se.
Yeah, no, I think it's one of the things you can say, which is actually when I started my internship, I asked my senior resident and my attendings, like, do you have any feedback for me? And then one of the things that they mentioned to me in the first month, that I should prioritize my patients based on their how sick they are. So I think you can actually talk about that. Say that when I started my rotations on the internal medicine floor, I was seeing patients one by one, and then one of my weaknesses was I was not able to recognize which patients were sicker than others. And then I learned that I should see them based on their sickness level. So patients who are very sick, I should start with them first, and then I should move to the next patients, so I can find if there are any patient who needs my help or needs a closer attention from the beginning of my day and the beginning of my shift, and instead of waiting a few hours to see them. So I learned that, and now I'm able to prioritize my patients based on how sick they are, and my senior resident and my attending helped me to achieve that. Yeah, so I think that will be a good one. Okay, so another question: for breaking the bad news, are we restricted to medical examples? Do they dictate following Spike's approach? Anyone would like to?
I don't think they're
tackle
going to
this?
ask you this. This is something that you will learn in residency. I'm not sure if a medical student have ever broken a bad news to a dying patient. So, I mean, this is something that will teach you in residency. This is something that comes with experience. I doubt that this is going to come up, but I'm not sure if anybody else has a opinion on it.
Can I say a comment?
Yeah, sure.
So for the breaking bad news, a lot of programs now, they have palliative care rotation where they actually have medical student rotating on these rotations. So probably it's not uncommon to be asked about breaking bad news question to the patient. They're not going to be expecting you to be 100% able to handle it, but at the same time, there are rules where what should you, the most thing that you should avoid in breaking bad news. You can't break bad news on the phone. You're the person, you have to be always make sure that the person is able to receive this news at this moment. You have to ask them certain questions to see their ability to receive this news at the moment that you're breaking the bad news, and try to avoid a major catastrophe just by breaking these bad news. So I think it may not be uncommon to be asked, but it wouldn't be 100% like if you're not able to handle it the way they want you to handle it, is not going to be a deal breaker, because it's something that you will learn during residency and by experience. But there are rotation now in medical school where they rotate on palliative care.
Yeah, that's actually well said. So the next question actually is a very important one. So what are the best questions we can ask the program director and the coordinator and the residents? So I want to ask Mohammed Hamsho, if you want to tell us what are the questions as an attending you expect the applicant to ask you, and then we also have other residents here who can answer the questions for the residents.
Well, we receive a lot of questions. I mean, always the candidate asks something. Personalized question. So when the candidate showed me that he took the time, he googled our program, he saw whatever we are interested in, what are the unique things we are doing. If one of the attending has distinguished research, he read his paper, he said, "Oh, I know that you're doing this and this, and I really like the idea. It's cool. What's your plan for the future? How are we going to develop the idea? Do I have the opportunity to participate in this research?" This will leave great impression. that this guy is really interested in our program, and he invested some time, and that will give him credit.
Yeah, that's perfect. Jihad, do you want to give us your input from attending standpoint? What questions you expect the applicants to ask you as an attending or a program director?
Sorry, you hear me?
Yeah, we can hear you.
Yeah, the most important part here to differentiate between questions. Don't prepare a bunch of questions and they just ask the same question.
As Muhammad said, for the attending, you need to ask certain questions, like probably about the program, how I mean, the examples in my mind that how do you evaluate your residents, what opportunities we have to participate in research opportunities. Especially you ask this question, especially for a university program. You have to know your program. You have to know that, for example, this community program, they don't have much research. I'm sorry. So that such a program, for example, doesn't have much research opportunities, so you don't ask about it. On the other side, that for example, some program here in New York, it's very busy. It's known to be like one of the busiest programs in the state. You can ask them what kind of experience I get, how much the cases are diverse, for example, or how confident the graduates from your program will be to start a practice. I mean, for example, because the programs here in New York, for example, are known to be like they put you to work so much, and the people who graduate from there, they get good experience in terms of like so many diverse cases. So just ask about something that you know the program is proud of. You want them to be happy to answer this question. You don't want to challenge them. You don't want to ask somebody about research when you know that they don't have a research, or somebody you don't want to ask a program about a fellowship when you know that this program doesn't have fellowships, or their graduates do not have opportunities to go into fellowships. For the residents, you can even always ask about the life outside the hospital, where they live, kind of what activities they do. Just try to ask more chilling questions rather than being so academic with them.
Yeah, that's very good. Any input from Abdul Hakim or Majid?
Definitely. Again, it's an opt-out. The opting you out. So don't shoot yourself in the leg. Don't ask, hours, salary, call schedule. You'll get that. You'll understand that from the program overview, from the fellows. But don't give the impression that you're lazy, that you're trying, how do I get by the least amount of work. So I want to emphasize on the no-nos, the stuff that you should not ask, those stuff that you should be careful. I used to ask about community outreach. I don't know, and then let the interviewer just talk to me about these things, and they keep going, and then they tell me about stuff that they did in the community. One idea, but be careful, don't kind of shoot yourself in the leg, as I said.
So as a resident, what do you think the applicant should ask the residents?
I think it's reasonable for the resident to ask about the city, the commute, food, stuff that are kind of neutral. I think these are reasonable questions to be asked to the residents rather than asking these questions to the attendings or program director.
Yeah, I think that's the time. If obviously the website or the presentation is not clear, I think it's totally okay to ask about the call and the conferences and that details. Also, a good question is, what's your favorite thing about this program and what needs improvement? And that's also a good question. So my advice on questions, like Jihad said, have them prepared. You have to prepare questions that before each interview. You can't do that for everybody the same. And have them in sections. One for the program director, one for each attending that you have researched and looked at their work, and one for the residents or fellows.
Yeah. So next question is, after the interview season, is it a good idea to send an email in February before ranking?
Of course.
Yeah. So I think that's actually everybody agrees on that. You should definitely send
For sure.
an email at the end of the interview season. February, I think it's too late. February, I think I would say end of January. End of January, like the last week of January, because that's where most programs will sit down and they will rank the applicants. I would send to everyone, all the places that I interviewed at. I try to share some of the points, and I would send that email definitely to the program director, and I would definitely send another email to the coordinator. Many people actually they ignore the coordinators. They think that, oh, this is just secretera, she's just doing her job. No, actually, she has a say sometimes in the decision regarding like, oh, this person, I didn't like him. Then the program director will be like, of course, we're not going to take this person. If my coordinator didn't like this person, or this person showed a very bad attitude, we're not taking this person. So be very nice to the coordinators. Always remember them. Always email them. If you want to email them separately, thanking them, that's definitely you should do. Even after the interview, I would treat them just like any other faculty member, any other resident. Don't ignore them. And then
I second that. The thank you letter is very important and early and individualized. And also, I mean, for us, it leaves good impression if somebody asks for second interview or second visit for the program. So if somebody is really interested in program and he has good chance and it's doable for him to go and have second visit, maybe it's a good idea.
Yeah.
Or the current situation is a first visit, which was offered to me once.
Well, I forget about that completely. Yes.
Yeah, but it could happen. Could happen. Mohammed, just quick thing. I know we're going over these questions, but this is really very important. I don't think it has been brought up. Tell me about an interesting case that you've had. It's almost like if you do 2 or 3 interviews, it's almost a guarantee that you're going to get one of these questions. And during the mock interviews, almost universally, all these interesting cases have been rare syndromes or rare conditions or something like that. They don't have to be. I think a very interesting case is a case that has some sort of human aspect to it, high communication skill used during this interesting case. And I'm going to give a very quick example of a true case that I saw in my clinic. You can assume that it was a medical student, but it was someone who doesn't speak English, and they came with their brother. She basically was complaining of difficulty swallowing, dysphagia, difficulty swallowing. Every time we get the history through the brother, and the brother spoke a little bit of English. And then visit after visit, EGD, manometry, all the investigations that you can think of are negative. And then one day someone decides to do the history from a translator, from a professional translator rather than the family. And then it was completely different. Basically, the patient had very poor oral intake. There was no actual dysphagia. And then further questioning, the patient was depressed and was experiencing hallucinations. And the patient who had maladaptation since she came from another country to the US, adding the fact that she doesn't speak English. And she was started on psych medications, on depression, anxiety medications, and she got better. So this is not rare, depression, anxiety. It's just the context and how this case was identified. This is so interesting. I think these kind of scenarios are more important. Again, you can bring up, I probably during internal medicine interviews, I did use a rare syndrome, but you can probably play, or I spend a lot of time convincing a patient to get a chemotherapy when they used to believe in only herbal medicine and holistic approaches. So yeah, just wanted to emphasize on preparation of interesting case. Use medical terminology, use medical words, dysphagia rather than, just as an example, rather than difficulty swallowing.
Yeah, that's great. So is it unprofessional to use the big headphones that looks like gaming headsets?
I don't think so. I've seen people using them as an interviewers. But if you don't have any other solution, then it's okay to use them.
Abdurrahman, I'm going to say it depends on who you are interviewing. If it was some young faculty, is different from someone who is 70 or 60 years old. That's just my opinion. I would probably try to avoid using it.
Yeah. So the next question, yeah, so that's actually something. If there is an event the day before the interview day, could you tell us about that? What usually happens and what questions to ask, how to interact with others? Would you give us some tips? So I think that happens sometimes. So in the past, they used to have like a dinner the night before or the same day of the interview. However, now you don't get the chance to meet with the residents. Sometimes they will do these sessions. I know that we did that at our fellowship program. We had about a 2-hour session with the fellows, and I think some residency programs may do the same. They have like a 2-hour session that you meet the residents, so you can have like a casual time with them. You ask them about whatever you want. So I think the main thing is just be like casual, professional dress up. Also try to engage in the conversations. I know it's going to be hard with the presence of like 20, 30 or 40 people. Sometimes it's going to be very hard, but try to engage, try to ask like good questions, try to make like some good interaction with the residents, and show them that you're interested and you like the city, you like the people, and be nice to everyone. I think that's the main thing. One more important thing: when you log into these sessions, most of the time that will be through Zoom or like WebEx. Make sure that you put your name as it should be. Like some people, they put their first name. Then nobody will know who you are, because when they take the attendance that this person came, they don't know who you are. Maybe your name is Ahmed. Maybe there are like 10 people whose name is Ahmed. So make sure that you put your name exactly as it should be. Don't just put like abbreviations like AT or AC. Put like your full name in the Zoom, and also don't use like small letters. Just like write it professionally. Like if you see like how I wrote my name on this Zoom meeting, I see some people like they use only small letters or they use like abbreviations. Try to avoid that when you have that meeting, because when they want to remember you and they want to talk good about you, they can actually see, oh, this person, that's his name. I'm going to write it down. I'm going to tell my program director that I like this person. I think we should bring this person on. That will help you. Any other?
Honestly, something happened during my meeting with the residents when I applied to Marshall University. That was actually before COVID. One of the factors that helped me to match is that I was nice to one of the residents there, and just happened that the director asked him, whom did you like from the applicants? And he was like, that person with name so and so. So it happens sometimes. Also one thing to keep in mind that since now the meetings on Zoom, and most of the time they happen at night, some of these people, they were having long day during the day, and they came after that because they assigned them to these meetings. So please be nice to them and ask them reasonable questions. Don't waste their time. Most of them, they just want to close Zoom and go sleep after that.
Yeah, I agree. Okay. There is another question. Is it acceptable to visit a program close to where you live?
No, hard no.
Yeah.
Before COVID, like a lot of people, they used to go try to walk into and try to talk to the coordinators and show interest in the program, and it was fine at that time. Nowadays, due to COVID thing and the policies in the hospitals, that they're saying like some hospitals, they still have no visitors. So programs, like personally in my program and in a couple of other programs around me, like the program directors, all of them, they don't want anyone to take advantage of the location these days. Even if you have like my friend, he had an interview in his program and they did the interview with him through Zoom. He saw the program director a few minutes after that walking in the hospital. They did not discuss the interview at all. So he passed it to him that I don't want to I don't want anybody to take advantage of the location, because you are in my hospital right now, so you can take advantage of this. But someone else in California, he could not come here. He could not walk in the hospital, see me, or he cannot take any kind of advantage like this. So they don't like it at all. Even during the interview, don't offer to come to the hospital. Don't offer it at all, because they don't want anybody to take advantage on this one.
Sounds great. I think we have one last question. I don't have any other ones so far. This question is, what's the best answer when asked why did you choose internal medicine and you did a different specialty back home? I know that it happens sometimes, like after you graduate medical school, you may need like a couple of years before you get your visa or you finish your exams and then you come to the US. So you may do like a different specialty than the one you are applying to now in the US. Anyone has a similar experience or would like to share their thoughts?
ما حدا بيجاوب هذا السؤال لأنه سؤال صعب.
It's very hard, you know.
Difficult one, yes, very difficult one.
I think it's a very hard one. I usually what I suggest, first of all, if the specialty back home is very close to the specialty you are applying to in the US, if it's like, let's say you did family medicine and now you are applying to internal medicine, or you had pediatrics and now you want to do family medicine, these are close to each other. The only thing is, like, if you did like pathology or lab or microbiology and now you're applying to surgery, I think that would be like an extreme. One of the things you can say that there are no available spots in that specialty there. That's possible. ممكن بتقول مثلا you were planning to come to the United States and you were doing your exams, but then in the same time you wanted to yeah, it's a very hard question. I don't know how to answer it clearly, but I would suggest just be honest. Why did you choose that specialty? You can always say, like, I changed my mind, like I went into this residency and I didn't feel like this is what I want to do for the rest of my life, and that's why I wanted to come to the United States and I want to do this other specialty.
I guess they can use like something from their CV if someone like did OBGYN back home and now they're applying for internal medicine. They can say something like, when I did my observership rotation in this or that hospital in the US, it opened my eyes to a new spectrum of practice that I was never exposed to before, and it made me to think about it and change my mind at the end.
Okay, sounds good.
Maybe just one more comment about the specialty. Maybe sometimes, you know, it might be useful to use the change in your life circumstances that it was going to be hard at the time to do this specialty, but now you have a little bit of a more maybe an older, or like your children are older or something like that. Change in your life circumstances that would allow you to spend the time that you would need in this specialty that you didn't have when you chose a different specialty back home.
Yeah, I mean, one of the things also I would like to share, like when I was applying for fellowship, I was asked a lot, like, why did you do hospitalist for a few years before applying to GI fellowship? And I always start with, well, after I did my residency, I had to do my J1 waiver for 3 years. So that's an excuse. And then after that, I was planning to, like, I did a master's degree and then I did this and I did that. So I showed them that my interest to that specialty did not stop. It actually continued. So you can always like try to find like, yeah, I would definitely link some personal things to your decisions. And I think they will understand because things change and they definitely understand that.
Mohammed, in regards to that, maybe not exactly related, but many people are applying for more than one specialty, and unfortunately, you cannot customize ERS application to send certain CV items to certain programs and so on and so forth. So I did apply to internal medicine and pathology. But I was truly interested in pathology, and actually 2 of the programs that I interviewed with actually asked me the question, are you applying to anything else other than pathology? One of my answers was like, yes, because I want to maximize my chance of matching, because I cannot afford, due to the current political situation or whatnot. You might not like my answer, but it looks like it went well at that time. It's like they got interested in the answer. Like, we truly appreciate your honesty and we understand your plan. But it depends on who you're talking to, what the situation is like, and some other factors. It's tricky it's very difficult to hide that you're applying to, a specialty when your CV speaks a different specialty, you know what I mean? So be prepared, at least think about this. This may come up. They should not ask you this question, but if it happens, just at least think about it now and see what you can come up with answers.
And I would say, keep in mind, people have situations in life that could make them change what's their priorities. And we see this a lot here in the US, even US, I mean, not a lot, but I know personally a few examples here and there, and there are US grads and US residents, and they decided to change specialties. They just decided that this is not the way I want to live for the rest of my life, and they changed. So you just need to explain in a convincing way that, hey, this is why I'm doing this. So you need to be prepared, especially if you have this kind of big change in your CV from specialty to another. But it happens, and everybody, I mean, people will understand. It happens a lot.
Okay, great.
If I may, just one more point I just want to emphasize, I noticed as well. So just be careful, please read every single word on the emails you're getting from the programs, your itinerary for the interview day. You really need to be usually they put all the information that you need in these emails, so it would look bad if you ask about something really very simple that is mentioned in the email and you didn't read it. And then now, the old days we used to travel to the city and do the interview, so it's very hard to miss an interview because of a time change. But nowadays there are different time zones, so be careful about this. You don't want, the last thing you want to do is to miss an interview because you live in a different time zone and you didn't realize that. And these are things I just wanted to make sure we mention.
Mohammed, last point from my end. It happened with one of the applicant I interviewed. She has hijab, and I think she didn't realize that she put the headphones under her hijab, and every time she was moving her head, the voice was terrible. So for those who wear hijab, just make sure that if you use the microphone or something, just make sure that microphone is outside. Make it not under the hijab, something like that. You can close to your mouth, so when you move, it doesn't affect by the hijab movement. That was like kind of weird, but I think it's important to mention.
Yeah.
One other totally unrelated thing, if I may ask everyone to look at Abdul Rahman. I think is given a perfect example of what the position should be of the screen. He's exactly in the middle. The light is just perfect. It's not too close, it's not too far. The position of the head is in the middle. So just as an example, and compare that to us, just because we're sitting in the room, we're probably the worst. But just be mindful of this. This is just as a good example, I think. The quality of the camera is good and the voice is good.
Definitely don't go to the interview with a t-shirt. So one small thing, honestly, to add is that please make sure that when you type anything on the computer, make sure that your microphone is turned off. It sounds very bad, especially if you're using laptop. Also, I noticed that sometimes the reflection of the screen, that it reflects on my glasses, my own glass. So people sometimes they can know if you're looking at something else while you're doing the interview with them, or if you're looking at your cell phone. That makes a very bad impression. One more point also, please Google your the people that you're interviewing with, even on YouTube, Facebook, LinkedIn, Google Scholar, PubMed. Do your homework on knowing everything about these people. One of the interviews, actually, I Googled YouTube. I put the faculty name on YouTube, and it turned out that he has an interest in some kind of like effect of economy on medicine. So we talked a little bit about this during the interview, and he spent like, out of 15 minutes, he spent like 10 minutes talking about that topic. And whenever people talk on camera, just listen to them and don't interrupt them, and they will be very happy because they're talking about themselves.
Yeah, that's actually a great advice.
I know we're going out of time. Just one last advice I leave you with. Inshallah, you'll have many interviews. So if you have a bad answer, or you think an interview went bad with one faculty, try to kind of just ignore it, move on. Don't, focus on the next one, the next person, and then the next program. I still remember my residency interview, in my opinion, was one of the worst, but apparently it was well enough that I matched there. So you don't know how they perceive it. Just tawakkal Allah and move on.
Yeah. Okay, that's great. I would like to thank everyone. I'm definitely thankful for the organizers of this session, Wissam, Abdul Qadir, Majid, Jihad, and I think everyone from the interviewers panel. You guys did a wonderful job. I'm really thankful to you, and thank you for the applicants for the questions that they were coming up. They were also very relevant and helpful. So I think we can conclude our session today. And if you want to contact me or contact any of the organizers, we're available anytime. And thank you so much, and have a wonderful weekend.
Thank you.